Well, there have been some big developments with the COVID vaccine in the past week, and joining us this morning to break it all down is Dr. Christopher Thompson from Loyola University. Thanks for joining us again.
Thanks for having me.
So Pfizer got the full FDA approval in the past week. So explain to folks what the difference is between emergency use and this full approval.
Right. So emergency use is just what the name says, that we're in an emergency, we need something, and so is this good enough to work? Full approval means that we've had a lot more safety data and a lot more efficacy data that all show positive signs for this. So the full approval really means this is a very, very safe vaccine, and it's also a very, very effective vaccine.
Any idea what this might mean for mandates moving forward? Already we know that many businesses and big companies are requiring vaccinations.
Right. So companies, businesses, things like that, they can require vaccination even if it's under emergency use. What I'm hoping is that this full approval gives people who are still a little bit on the fence about whether or not to get the vaccine, will give them that little nudge in the right direction. And the Kaiser Family Foundation did a really nice study that suggested that people might actually go get the vaccine once it is fully approved. So I'm hopeful that that happens.
And we've been talking about booster shots, and they're now recommended specifically for people who are immunocompromised. When do you see this becoming available to basically everyone?
Yeah, so a slight difference. For people who are immunocompromised, we're recommending a third dose. So the third dose gets them up to that level of protection that people who are not immunocompromised already have. So that's not considered a booster. The booster is to boost the response that may have waned over time. And so we're seeing that in people over the age of 60 in Israel, and even in the US, we're seeing recommendations for people who are over the age of 60. Some current data says that, our protection dropped from about 90% to about 80% over a couple of months. So still really, really good protection against Delta, and still great protection against severe disease and death. So there's no real rush to run out and get it right now. But I think people over the age of 60, who are our most worrisome population as far as getting severe disease, they should start considering that.
So when it comes to getting the booster, do you have to get the same booster as the original first two shots that you received?
Yeah, so there's really not good data about the booster overall, which is part of why I'm kind of hesitant to say what the data says, which is kind of my MO for our interviews. So I don't think so. The limited data I've seen suggests that, if you get the other company's mRNA vaccine, it should still be effective. But the data is really, really limited. You're probably better off getting the same one that you had. And I think that's what most people are recommending.
And then for those who are starting to get the booster, is there any data out yet if they're starting to see some of the side effects that they got from the original shots?
Yeah, there's really limited data about that. So I can't really comment at this time.
What about this monoclonal antibody vaccine that they're talking about that we ran a story on earlier this morning that's supposed to be effective against Delta?
Yeah, so monoclonal antibodies are a lab version of what our body already makes to fight off infection. And monoclonal just means that it attacks one site on the virus. So it's not a vaccine, it's a treatment that we're seeing, and it seems to be really effective against this Delta variant, and it starts to kind of wipe out the infection as soon as you get the infusion. So it's a really great step forward in treating infection with Delta, but you're still better off getting the vaccine to prevent ever getting it in the first place.
All right, Dr. Thompson, always a pleasure to have you on. Thank you so much for your insights.
Thanks so much for having me. Have a great day and stay safe.
You're welcome. You as well.